How do infections cause autoimmune arthritis? Imagine your body's defense system going on high alert, mistaking healthy tissues for invaders. That's what happens when infections play a role in autoimmune arthritis. Normally, your immune system fights off harmful germs like bacteria and viruses. But sometimes, certain infections can trigger a misfire, leading the immune system to attack its own joints and tissues. This process is called autoimmune response, and it's a key factor in conditions like rheumatoid arthritis. Infections can activate parts of the immune system that are meant to fight pathogens, but this activation can get out of control. For example, some viruses and bacteria cause the releases of substances that tell the immune system to produce autoantibodies. These autoantibodies are special proteins that mistakenly target the body's own tissues, especially in the joints. When this happens, inflammation kicks in, causing pain, swelling, and joint damage. One way infections do this is through inflammasomes. These are tiny structures inside immune cells that respond to infection. When they get activated, they release chemicals that promote inflammation. If this process continues unchecked, it can lead to persistent joint inflammation seen in autoimmune arthritis. Another mechanism involves bacteria that cause periodontal disease, which is gum disease. These bacteria can modify proteins in the mouth, making them look foreign to the immune system. When the immune system reacts to these altered proteins, it can also start attacking similar proteins in the joints. This process is called citrullination, and it's linked to rheumatoid arthritis. Understanding how infections contribute to autoimmune arthritis helps doctors develop better treatments. For example, treating gum disease might reduce the risk of developing rheumatoid arthritis. It also guides research into therapies that can calm down the immune system's overreaction, reducing joint damage. Monitoring infections and managing them promptly can be important in preventing autoimmune flare-ups. If an infection triggers the immune system to attack the joints, controlling that infection might help keep the autoimmune response in check. So, infections are more than just temporary illnesses. They can set off long-term immune problems that lead to arthritis. Recognizing these links helps both patients and healthcare providers take steps to prevent or lessen the impact of autoimmune arthritis.